Coming up in 5, interview with Dr. Adrian Rudd, consultant urologist, Mount St. John's Medical Center.
So men will go through puberty around early teenage years. It's also said that it varies for all individuals, and it's generally thought that women go through, or girls go through puberty before men. It's a period when young boys transition into adults, so it's a period. There are a number of changes. Here it comes with physiologically, or in the body, it comes with a change in the voice. It comes with increase in facial hair, body hair. You start noticing getting sideburns, your beard. It comes with hair on your chest. It comes with change in the genitals. At that time, hair starts growing around the genitals. The testicles get bigger, firmer. The penis gets bigger and longer. And these are the changes for puberty. And it's a gradual process. Some boys will go through it early. Some will go through late. Some go through spurts and then it quiets down, but generally it's completed around age 18. It can be a very difficult time for some boys, and it is always helpful if you have family, particularly a male family figure, to guide you through and let you know that these changes are normal, and it's all about growing up. And if you don't have the support, you may tend to think something is wrong. You may hide it, you may resent it, but it is all natural. Some people get forced into having sexual encounters, or some people are made to feel afraid if they're not having sexual encounters. So there are lots of issues that come with the males going through puberty. I mentioned the drug abuse earlier, and this is the time when youngsters are exploring. They're in high school, people start drinking, have smoking. These things are illegal, or they're not good for young people, but the truth is it happens. I think the most important thing is having that support, having that positive guidance, that positive figure that you can discuss these changes and these feelings with, and these people can steer you in the right direction to get you through this challenging time.
And abuse of alcohol, abuse of drugs. Drugs meaning what kind of drugs? Marijuana?
Well, the truth is alcohol is a drug. Marijuana
alcohol
is a drug.
Yes.
The challenge with drugs is, so generally a drug is anything you put into your body which alters its perception and functioning. Now, alcohol affects your way of thinking. It's slow. It's what's known as a nervous system depressant. Initially, it can affect your inhibition. So in the early stages, you're no longer. It gives you courage because your inhibition is removed. So you talk a lot, you chat a lot. But eventually, as you take in more and more alcohol, in the acute setting, it can make you sleepy. It can delay your response time. That is why it is very bad. It should never be used, and you shouldn't drive. Because as your response time, you lose your inhibition, you feel more confident, you think you're doing things the way you normally do, but you're actually doing things slow and you just can't respond, you just can't function. That's in the short term, and as you can imagine, this leads to motor vehicle accidents, trauma, violence. But in the long term, excessive alcohol can damage most of your organs, particularly your liver. Smoking is another thing, which the earlier you start, the worse it is, because it's a cumulative thing. Not many people in Antigua, I find, smoke cigarettes, nicotine, which is very good. I would like to say keep that up. I think most people understand that it is harmful. Cigarette smoking is bad. It affects everything, anything you can think of from head to toe. It will damage and can lead to potential cancer anywhere from head to toe at some point. So if you've never started smoking, and you're going through puberty, you're at that age, then it just don't start. There's some people that started 30 years ago and are so committed and so addicted that it's a way of life. It's hard to get them to stop. But if you haven't started, I mean, you look at the box of cigarettes and it says smoking kills, it has all the warnings. So if you haven't started, don't start. Marijuana is very controversial, as you'd imagine. Now they're everywhere. We're legalizing. We are legalizing. We are trying to get or decriminalizing. Everyone is now looking at medical marijuana. There's a lot of evidence suggesting now that marijuana isn't as harmful as they once thought. It seems to not be as harmful as nicotine smoking. But where the discussion now is what is marijuana? Marijuana isn't a bag of bush. Marijuana is leaves which contain compounds CBDs and THCs. And then right now everyone is trying to find out, what do these CBDs do? What do these THCs do? What is the reaction on you? So you can now isolate these compounds, and you'll take this and get high. You'll take this and not get high, but you will sleep better. You'll take this and you can concentrate better. You'll take this quantity and you'll get, you won't have pain. So these are the things they're looking at from a medical perspective. It's still very early. There are lots of people that are overly ambitious, but we need the evidence. We're doctors. We need hard evidence, hard facts to show that these things work.